I made up this illustration to show the relationship of the periodontal condition with the arteries, and I kind of put them side by side so that that makes a little bit more sense. This is a cross section of a tooth. On the left you see where the gums are pink and healthy and they fit very tightly against the neck of the tooth. On the right you see a gum that's red and inflamed and infected, and this forms the pocket, and this is the pocket that is measured. It's probably 4, 5, or 6 millimeters. When the pathogenic or bad bacteria get down in this pocket, these are often anaerobic bacteria. They cannot live in areas with oxygen, so they love and they multiply heavily in this area. Now, once the lining of the pocket becomes ulcerated and bleeds, there is a direct communication of these bacteria and they zoom right into the bloodstream. And this is a cross-section of an artery, and this is the premise of the Bale-Donine method, is that Dr. Bale feels as if we can control the inflammation in the artery, we can control these cardiovascular events. So this is the progression of an inflammatory process. And one of the things that I will show you here is that the periodontal bacteria actually separate the endothelial cells and allow cholesterol to be deposited into the wall of the artery. Further down into the wall of the artery, you see these little white areas. This is calcified plaque, and this is what would be considered stable plaque. This is not dangerous. The dangerous plaque is what is called soft plaque. It's the plaque near the surface. So if you have a heavy deposition of soft plaque or cholesterol and it becomes unstable, if you have a rupture of the lining of the artery, the response is the formation of a clot, and that blood clot is what causes the heart attack. One of the most encouraging things that's coming down the line in the research is that if periodontal disease is treated and controlled and these bacteria levels drop, this can actually reverse itself a little bit. It can't go back to baseline, but it can stabilize. So the whole concept here is that we can stabilize the health of the arteries even if there is underlying existing disease.